Hi everybody, Ziv Simon here. I'm the creator of Surgical Master. Welcome to this video. And in this one, I'll talk about a flap design dilemma when it comes to replacing a central incisor with an implant. And this is part of your preparation for my upcoming webinar on the best implant flap designs. I wanted to share some cases with you so you can start developing a good understanding of incision outlines and flap designs when it comes to dental implants, and understand the rationale behind it, and also develop your own rationale and your own philosophy when you're dealing with similar cases in your practice. And if you're a little bit insecure at the moment about what is the ideal flap design for dental implants, don't feel too bad, because a lot of us have dilemmas, and there are more than a couple ways to treat the same situations. Everybody has their own biases. And what's really, really important to know is that when you make a decision to design a certain flap, there has to be a rationale behind it. There has to be a reason why you're choosing this approach. Not because I said so, you've seen it in a lecture, but because there's a certain goal and an intention to achieve something. And that's exactly what I'm trying to explore in the videos on flap design. So when you come to the webinar, you'll be so much more clearer on the rationale behind all these incisions and what we're trying to achieve. The patient in this case was referred to me by my good friend Rick Glassman, practicing in Westlake Village, California. He's a wonderful dentist and surgeon and just loves what he does, and we both get excited when the plan comes together. So thank you, Rick, for referring this great patient to me. I love our interactions and collaboration, especially when it comes to disasters in the aesthetic zone. I hope you watched the previous webinar on how to handle these situations. So this patient came in with a localized 8mm pocket on the buccal aspect of a central incisor. The tooth had a root canal with something that looked like a periapical lesion. And then we had a scan taken that showed the large lesion, but also a crack in the mid-root. And we decided to have the tooth extracted. The site was also grafted, very similar to the techniques I showed you in the previous webinar. The focus of this video is not so much the grafting and the extraction process, but more the flap design for the implant, which is the focus of the next webinar. But I promise to go back to this case in the future and share more details about the bone grafting and the planning and the complexity of this case. So in this case, I extracted the tooth, grafted the socket, and Dr. Glassman used the original crown and bonded it to the adjacent teeth, which is a great thing to do for patients so that they have a permanent replacement for the missing tooth while the patient is in the process of treatment. It's not for every case, but it certainly worked out for this patient. So technically, this was a Maryland bridge that we used during the treatment. The downside is that it needs to be disassembled every time you're accessing the site surgically, and that's obviously a disadvantage. But from this patient's perspective that is traveling quite a bit and is disappearing for long periods of time, it was definitely advantageous. So about 4 months after the extraction, we started the planning process. We took an impression of the edentulous area and we digitized it, and also took a CT scan and started planning the implant positioning. Now, this case was somewhat complex because of the patient's occlusion, and although the ridge was great in terms of the bone volume and it healed great and it looks like it's a winner case, actually it's not as easy as it looks, and it took Rick and myself some time to come up with a conclusion of where to place the implant, because the implant crown is going to be in a deep bite like the original tooth. And there are some difficulties with that I'm not going to get into in this video. We had quite a bit of time to plan this case because this patient was ready for implant surgery only about 2 years after the extractions because of different circumstances. He was in no rush to move forward. He had a beautiful Maryland bridge bonded restoration that looked very aesthetic and functional. And when the time came, we fabricated a surgical guide that would replicate the position of the implant in our computer software. And the bonded crown naturally needed to be removed for the procedure. So now you're looking at the site as it heals the day of the implant procedure. You can tell the soft tissues healed quite nicely, and the margin of the tissue was molded by the provisional restoration. Here's the occlusal view where you can see the inflammation under the pontic site, which is actually quite common and almost to be expected. Now the question is, if we're about to place a dental implant, what would be the best approach or the best flap design for this case? Well, it depends, of course. It's not always obvious, otherwise I would not make this video for you. And I think before you decide on the flap design, you need to ask yourself a few questions that will help you make a decision. The first thing that I look at is the tissue quantity and quality, and I try to determine how far from ideal is the soft tissue that I'm looking at. It's almost never perfect, and if you're involved with implant surgery, you know exactly what I'm talking about. We're always looking for more tissue quality and quantity, which is always more critical in the aesthetic zone. So I'd like you to pay attention to the details, and some of us can immediately spot the deficiencies and make some decisions based on that. There are quite a few software on the market, but one thing that is relatively easy for me is just to trace one central incisor. You can do it with Photoshop, very, very simple, and just copy it and then mirror image it, and immediately you'll see the deficiency in the vertical height of the soft tissue. Very slight, but you see it. And also the deficiency in the mesial and the distal papilla. These small little details will help you make a decision in regards to flap design, so I suggest you look into that. The contour of the tissue was quite good. I was very happy about the thickness, and I know this can be managed by using a provisional crown and changing the emergence profile to mold the tissue a little bit more. The next factor I'm going to look into is what type of treatment protocol am I going to use for this case? Is it going to be a two-stage approach where I'll place the implant, leave it submerged, and then uncover later on? Or use a one-stage protocol with a healing abutment, or a one-stage with a provisional crown, which is technically loading the implant? So based on what I reviewed so far, in the next video, I'm going to show you the flap design that I used in the actual surgery, and I hope this is going to be very useful to you. I also look forward to seeing you in the webinar on the best implant flap designs. If you didn't register yet, go to Surgical Master webinar, sign up so you can attend. And in this webinar, I'm going to give you a whole lot more information and options on how to handle the soft tissue during implant surgery. But in the meanwhile, I'm going to see you at the next video where we're going to talk about the flap design dilemma. See you then. Hi everybody, Ziv Simon here. I'm the creator of Surgical Master. So you created this great implant site and you're ready for the procedure. And now you're a little bit insecure about what is the best way to handle the soft tissue during the surgery. Should you reflect the flap? Should you go flapless? Should you preserve the papilla? And if yes, what is the best way to do it? And in general, what is the best way to handle the soft tissue in a particular implant case? If you have these questions, you're not alone. Many doctors are a little bit insecure and have many dilemmas when it comes to the soft tissue handling around dental implants. I'd like to invite you to a webinar that will answer all of these questions and will help you to be better in soft tissue management during implant surgery. I'm going to talk about what I think are the best ways to handle the soft tissue during implant surgery. Go to surgicalmasterwebinar.com to sign up. Once you sign up, you'll get a confirmation and some additional information and resources that will prepare you for the webinar so you can maximize your learning experience. In this webinar, I'm going to talk to you about the different soft tissue techniques that I use in my practice. I'm going to talk to you about flapless surgery and what is the best way to do that, but I'm also going to give you some options for flaps and the exact incision outline. I'd like to make it very useful and practical for you so you can apply it in your practice. To sign up, go to surgicalmasterwebinar.com. All you need is an internet connection, a computer, a tablet, or a phone, and you're in. I'm going to show you how all of this works, and I know this is going to be very useful and practical to you. I'll see you at the webinar on the best implant flap designs. See you then.